Whether it's a disc herniation, thoracic outlet syndrome, or a pinched nerve, posture is always a contributing factor. So today I want to take a minute just to show you some simple things that you can do to improve your posture. Hi, I'm Dr. Thom Green from Elmira Family Chiropractic, and the first thing I want to show you is shoulder squeezes. So oftentimes when we're sitting all day at the keyboard, we get that rounding in our mid-back, our thoracic spine. So what you can do is you can do shoulder squeezes. So you can bring your shoulders back and down, kind of like you're putting them in your back pocket. Do that 10 or 15 times, and that will help take the tension off those traps and those rhomboids between your shoulder blades. The second thing I'll show you is chin tucks. So get in a tall posture, and what you're going to do is you're going to take your chin and you're going to tuck it in, and then you'll bring it forward again and then tuck it in. You should feel lengthening in the muscles right at the base of your skull. You don't want to be bending your head forward and backwards. This one I'd recommend doing sitting or lying down. It's a simple form of traction to help open up the joints in your neck and help take some of the pressure off the nerves. So what you can do is, if you're in a chair, then you're going to take like a tea towel, kind of like this, and you're going to cup that just around the base of your skull and tip your head back slightly into extension. So if you're to see what that looks like, it kind of looks like this. Tip your head back, and then you'll use your arms here, using your arms to lift and you should feel a nice gentle pulling pressure in that neck. Again, if the extension causes more pressure or pain into your arms, then don't do that. Just keep your head neutral and gently pull up. The next thing I'll show you is wall angels. So this can really help to bring your head back in over your body and reduce the rounding in that mid-back. So what you do is you place your butt against the wall. So your sacrum, your tailbone should be flush against the wall. And then you're going to put your shoulder blades, your elbows, and you're going to be putting your hands in this field goal type position. Your head should also be touching the wall, and then you're going to slowly bring your arms up, slide your hands up the wall, keeping everything glued to the wall, and then bring it back down. So your head, your mid-back, and your sacrum should never leave that wall, and you're going to repeat that up and down that wall. Do that 10 or 15 times. If you're the kind of person who's on the phone all day, or you're mousing with one side, oftentimes you end up tipping your head to one side. So if you do lateral bends, then this can take the pressure off that side. So tip your head away. You should feel stretching in that side of your neck. You can even add a little bit of downward pressure on your head and even on that shoulder here to help open that up. Repeat the opposite side too. And then do that back and forth with a slow stretch at the end. Maybe hold it for 5 seconds. Do that 10 times on the hour. Okay, last one I'll show you today. This is for your thoracic spine, your mid-back, sort of right above that bra strap for you women or guys, where you kind of feel that tension from slouching all day. So what you can do is get a foam roller. It's kind of like this, very dense foam. And you can put that on the floor, right in that mid-back. Then you're going to give yourself a hug. That gets the shoulder blades out of the way. Then lift your hips, and then you're going to roll back and forth, up and down that spine. This will help take the tension out of those muscles. You can even lace the fingers behind your neck, and then just gently lean back over that and breathe on here for 10, 15, 20 seconds, even a minute. And that can help take some of that tension out of that mid-back. So I hope that these simple stretches and exercises can help you. I know they help me on a regular basis, and this will help improve your posture, which can help reduce, again, tension on those nerves, can reduce neck pain, and if you're having any other problems like that. So again, I'm Dr. Thom Green. I hope you have a great day. If you have any questions, just leave them below or send me a message.